The industry's changed, and clearly we need to be at the forefront of that. It's not easy. The models that we have today are simply not going to work as we go forward, so we need to be pretty innovative. And when I think about the levels of shared value and all of the things that you're talking about in the research, it's not just applicable in the academic world, it's very applicable in our business world. So the relevance of it, never been more important. I'm always careful to, when I talk about initiatives, not to hone in on one, because as you know, it's not as simple as one model. You do it one time and then you can claim victory. But we're learning a lot in the model that we have with TrueCare, which goes out into the very poor urban areas in India as well as the remote areas. We do business right now in about 10,000 villages, and we get about 40% market coverage. If you do the math on that, that's 60% that we don't even touch. And on over 1 billion people in India, that in one country alone, there's an enormous opportunity. But we've invested into remote initiatives. We hire our sales force locally. They know the local language. They're generally not a medical sales rep quality, so we have to do some extensive training. A good example on one of the levels of the shared value in terms of redefining the value chain. Good example of that. I think there's a mindset shift that has to occur in many ways. We all grew up, I'm generalizing in a significant way now, but many of us grew up in the pharmaceutical industry that if you had a very productive R&D pipeline, you launched a product in the US or Western Europe or Japan, truly a developed country, you get a lot of profitability. It seemed as recently as 10 years ago that that model was very sustainable. Well, we've seen not only is that model, for a variety of reasons which we could debate, hasn't been as productive, regulatory, science, whatever it happens to be. Put on top of that all the macroeconomic issues and the political environment, the fact is we need people who will start thinking beyond the model we've all known for decades and talk about how do we enable this unmet medical need that we all talk about in our vision statements, our mission statements, and we do as well. But the TrueCare example that I just gave you is a good example that you have to start taking some action. Doesn't mean that you just pour money in, good after bad. It has to have a pathway to profitability and also meeting the need, truly the definition of shared value. But I think it's mindset is the simple answer to your question. But the fact of the matter is there are literally billions of people that have a need for the type of products that we produce and can deliver. But as I'd said before, that's all very interesting, but if we can't find a way to meet the local market needs and do it in a profitable manner, it becomes nothing more than this very interesting PowerPoint slide or a position paper or something we will do in 5 years. We can't wait 5 years. Actually, society can't wait 5 years. And honestly, I think the two can coexist together, but we've all come under the environment of healthcare being fairly profitable, and anything that we do that doesn't fit a typical pharma profile generally gets deprioritized. I don't think any of us have that luxury to do that going forward. It's that simple. There is an issue of economics here as well, so it's coming back more in balance, but when you look at the scale that's available to us as an industry, and the need from the public at large, I would hope those two worlds can collide in an effective way that everybody wins. Well, it's valuable without question. We're all learning from each other. We've been, again, a generalized statement, but we've been a very insular industry in many ways in that we protect our intellectual property fiercely. We're ultra competitive in many ways, and that's all still going to be true for technology and molecules and deep innovative science, and as it should be, no issue there. But when it comes time to dealing with models and how do you get to models of sustainability into these areas that maybe it's not really intellectual property, but it's a business behavior, it's a mindset, it's a way that you can actually implement all of the stuff that we've talked about for decades. The fact that we're all here together with BD and Medtronic and Novartis and Abbott talking openly with, I don't know how many companies are represented in the audience, these are important steps. but these have to continue, and this has to be the catalyst for something much bigger. Much of this comes down to relationships, people in senior levels who are willing to open up, cross-fertilize within organizations, all while respecting privacy, confidentiality. We can have it both ways. We don't all need to live neatly in silos. These kind of forums, and what we do, more importantly, coming out of this forum, is what makes the difference. If everybody goes back to the airport, they go their own way, everybody's enthused, they're energized, but if the half-life of this, as we get back to our day job, is only a couple hours or a couple of days or a couple of weeks, it doesn't work. That's why it has to be part of the day job.